Hi, I'm Joellan Mullen with Sickbay. My role here is a clinical informatics specialist. Yeah, so a current role of a nurse in a NICU, if it's a higher level NICU, they tend to have 1 to 2 patients, and they are the most fragile babies. These babies have been born premature, and what that means is typically their lungs aren't developed very well. They may be on a ventilator or another assist device. Their brains are still pretty immature, and those type of things. And the longer the stay in the NICU, sometimes those families who are at the bedside have to go back to work. And so being able to balance caring for that family as well as caring for the baby, giving updates to the parents. The nice thing about sick bay is it does give that trend and that patient trajectory. So you can show families over time what the patient's been doing. It's really hard to explain to somebody non-medical exactly what all those numbers on the monitor mean, and being able to show them a graphic view of exactly what's going on with the patient. And look, their heart rate's been trending up. We were able to wean off some of the oxygen and show those trends. It's a little bit easier for the family to understand. Hospitals are starting to rebuild, remodel. They are moving towards these private rooms. It's better for the patient families. They have that family bonding. Unfortunately, for nursing, though, it causes a little bit of a hindrance. You can't really hear the alarms. You can't see all your patients at once. And sometimes it actually can be a safety concern. So being able to see with sickbay all your patients outside the room, you can pull up a multi-mon screen and see multiple patients at once. I actually had one nurse tell me when I was on site, typically in the NICU, you may be holding a baby, feeding them, that type of thing, and they're able to pull up their other patients on the computer and see exactly what's going on and what's happening, and it made her feel more comfortable that she was able to keep an eye on everybody else while she was dedicated to one task. Yeah, so typically at the end of shift or during multidisciplinary rounds, the beginning of your shift, you really want to look back and see exactly what happened over the previous shift and see what the patient trajectory was. So being able to see a trend of the vital signs, but as well as the medication and lab results, can really help you make that decision as to which way the patient's going. Because it's one thing to look back on the monitor and see, oh, their blood pressure's trending up. So the patient must be getting better. If you're able to pull those medications, labs, and even the ventilator signals in with that, you may see, oh, well, we were titrating up on the medication, and that's why the blood pressure is getting better. So it gives a more complete story of exactly what's going on with the patient. Yeah, this is a great question. So, in some of the EHRs, you actually can see a trended view. And what that is only the data that's been inputted. And so, in a typical ICU, you may enter hourly vital signs. If it's a very sick patient, it may be every 15 minutes. Where sickbay comes in is you're able to see the second to second data. For neonates, any patient that's born before 37 weeks or is having respiratory issues or otherwise indicated, the American Academy of Pediatrics has recommended a car seat test. And what that is kind of what it sounds like. You put the baby actually in the car seat that they're going to be traveling home with, and you monitor them. Typically, it's for 90 minutes. It could be up to 120 minutes. And current practice is the nurse would have to sit there and watch the patient for that entire time. Typically in a NICU, you may have 2 patients, sometimes 4 patients, depending on the level. And so for that 90 minutes, you're focused in on your one patient. So somebody else may have to monitor your other patients. So how sickbay comes in is we're able to capture that data and monitor that test on the back end, where the nurse can then review it later. And so when you run sickbay with a car seat test, the nurse can actually set up the baby in the car seat and then go about and do some other duties and then come back after that 90 minutes, review the test, see if it is a pass fail, and then move on from there. In addition, we provide a PDF, like a basic report, that can then be exported up into the EHR to provide the proof of the vital signs during the test. As a nurse walks in a room, they have to synthesize a lot of data at once. So they look at the cardiac monitor and see what's going on with the patient. If the patient's on a ventilator, they have to then look at the ventilator and process all that information and try to put it all together in their head. And it does after time, affect them with cognitive burden. And so Sickbay, what they can do is weave together all these devices together into one platform. So as you're looking at one monitor, you're seeing everything that's going on with the patient and able to synthesize all that together, and help, see what's going on if you need to address any alarms or if the patient's deteriorating, that type of thing. Rather than having to sit there and process things, for 10 to 15 seconds or even a full minute, you're able to see things, act on it, and move on. It helps with that stress at the bedside, making sure you've got everything together. It's already pulling that together for you. So therefore, the nurse has less stress during their job and therefore increases their satisfaction.